Here at Coastal Animal Hospital, our culture is based on our belief in next generation medicine. Everything we do is dictated by trying to take the latest science for the benefit of animals. Most practitioners, most veterinarians practice medicine the way that they were taught. They don't really change their practice to update it to achieve the benefit of this latest science. One of the biggest examples of that that most veterinarians are still doing is with a spay. And most veterinarians are still removing the ovaries and the uterus. And this is really one of the big differences with Coastal Animal Hospital, is that we're okay saying, oh, there's a new or better way of doing it. I'm okay with that. So we only remove the ovaries. Not only that, we actually took it a step further and we do it laparoscopically. We read the papers that show that it is less painful, there are fewer complications, it makes the anesthesia safer. All of these benefits come through and we dove in head first with it. That's really the big difference with next-gen medicine. Even looking at our vaccines. We have a 4-year vaccine. A lot of veterinarians are giving the distemper parvo and the FVRCP for cats, even on an annual basis. Science has shown that that isn't necessary at all. Less is better a lot of times, and that's what we're okay with doing. It's not profit-driven for us. We're really looking at the benefit of the animals.
As a first-time dog mom and single dog parent, I was pretty terrified going into it, but with the Coastal Animal team, I felt like I had so much clear communication, and they really built me up and gave me the confidence that I needed to go from my appointments into my everyday life raising Stella, my dog. They were from point A, first contact with them, to now she's a year old, so thorough, so communicative, always put me at ease, never made me feel like a question was silly, and they've just always been there for me every single step.
Ultimately, what I love about my job is getting down on the floor and spending time with pets even before I start any of my clinical exam. And then we get to talk as a team about what's actually happening with your pet. Your observations from home, my observations in the exam room, and then together we come up with a plan that's going to make them healthier. Because ultimately, it's going to be up to you to initiate that plan at home. And so I spend as much time as needed to make sure that you understand what's going on with their disease, with their health, and any fine tunes or tweaks that we need to make to keep them as healthy as possible.
I've referred family members, friends, colleagues, and of course I want Coastal to grow, but the real reason I referred is because I wanted my friends and my families and colleagues' pets to have the best care.
These advances are going to lead to better outcomes. It's going to lead to less pain. It's going to lead to less suffering. And that's why we care about this. That's the only reason, is because the animals will do better.